Namaskar. My name is Dr. Ishant Mandavaya, and currently I am working at Indira Gandhi Medical College, Shimla. Today we are going to have a little talk about importance of treatment adherence. So first of all, I have to explain it to you that what do we understand when we are talking about adherence. So adherence is something that we are discussing with the patient about his plan, about his treatment, about the drugs he is going to take. So all this, which is going to give the benefit to the patient and the healthcare provider and the contribution of drugs to the patients, it all comes under the treatment adherence. So treatment adherence is generally regarded as an important factor in achieving optimal outcomes across many disease states. Poor adherence to treatment has the potential to impact outcomes on multiple levels. What are the factors which are going to affect the adherence? There are several factors such as gender identity, social support, income, occupation, education level, patient's personal belief and perceived necessity, discrimination, doctor-patient relations, religion, and healthcare system stigmas. These are the factors which can affect the treatment adherence, and all of them contribute in a particular way to achieve a successful health outcome. And medication adherence, as defined by WHO, is as the degree to which the person's behavior corresponds with the agreed recommendation from a healthcare provider. It can have a tremendous impact on quality and length of life, health outcomes, and overall healthcare costs. So, following are the points I'm going to discuss very briefly. Due to the shortage of time, I'm going to discuss very briefly few of the points which a patient has to take care when he is taking medicines for high blood pressures or any other disease. And these are the things we can share with the patients as a healthcare provider, such as when the patient is taking the medicines, he has to take the medicines as prescribed, or medication adherence is important for controlling chronic conditions. Adherence and compliance are the two pillars of the better outcome from the drugs. And patient, especially if he is suffering from a chronic conditions and need a prolonged medical attention. Treatment adherence will contribute to patient's wellness and longer life expectancy. Also, patient has to take care that he has to take all the medicines for high blood pressure as prescribed by the physician. He cannot miss in between any medicines, or he cannot miss the doses or just take the doses by himself. Also, patient has to understand that if there is any drug interaction with the drugs of high blood pressure, he has to be very careful about this one. Especially there are few drugs which are we are getting over the counter, in which it is labeled that do not take if the patient has if you have high blood pressure. So patient has to be very cautious about such things. He has not to take such drugs which has interaction with high blood pressure drugs. Another thing, he has to understand that if there is any drug interaction or any adverse effects over him with the drugs he is taking, he has to immediately consult a physician. He has to talk to the doctor, and he has to understand the whole process of adherence that he is going through for the benefit of the patient himself and for the positive effects of healthcare system. So these are the positive findings I was talking about. Now let's talk about a little bit about the non-adherence to treatment and medications. This can have consequences such as waste of medications, disease progression, reduced functional abilities, and a lower quality of life. So when we talk about prescribing medicines to the patients of high blood pressure, we have to address them properly. We have to share the things properly. And as a patient, he has to understand the benefit he is going to get from the drugs and the healthcare provider for him. Thank you so very much.